So, on the occasion of the upcoming World Vascular Day, which is on the 6th of August 2026, we decided we'll take this opportunity to maybe spread a bit of awareness on vascular disease in India and what it does, how it presents, what we can do about it. So, I am Dr. Robbie George. I am the Chief of Vascular Surgery at the Narayana Health City in Bangalore. My colleague, Dr. Rajesh, we work together in the vascular surgery department. And we are one of the earliest vascular surgery departments in the country, isn't that right, Dr.
Yes.
Rajesh? So, it's been well before 2010 is when our department started, and since then it has grown. And it's great to see that the amount of vascular treatment that is happening all over India has really dramatically increased compared to that. So let me just start off by asking Dr. Rajesh to just give us a context of what is the burden of vascular disease that India and the world faces.
So as you all know that now, we are in the year 2026, and globally the vascular diseases, cardiovascular diseases has increased tremendously. First of all, we are all aware that India is the diabetic capital of the world. Why I want to tell this is that diabetes increases the complications of vascular diseases, cardiovascular diseases. So the worldwide statistics is around 200 million people worldwide are affected by vascular diseases. As we see, as my colleague Dr. Robbie was telling, we are in a cutting edge and excellent vascular center, which has been since 2010, and we do a large volume of vascular work in terms of endovascular, that is a minimally invasive work, giving solutions to all the vascular diseases, whether it's an arterial disease or a venous disease or aneurysms, which we are talking about. All this we treat it. Now, secondly, what I would like to emphasize is this is going to go, the global burden. So if you look at the basic pathophysiology is atherosclerosis, that is hardening of the artery, all the blood vessels in the body, where it narrows and it causes blockages. Wherever the blockages occur, this will lead to an event in terms of blockage in the legs causing pain and later on manifesting with a wound or an ulcer which is not healing for a long time. These are all warning signs of a vascular disease. So globally, as well as in India, the number of vascular diseases are going to grow, and more amount leading to amputations. So whole our principle is to prevent amputation, increase the awareness among the common public about what are the symptoms, and seek the medical attention as early as possible to prevent this amputation and mortality or morbidity in these patients. So I will at the same time ask Dr. Robbie, how do you, for the common public and for the patients, what are the warning symptoms of a vascular problem? So we have asymptomatic, symptomatic patient. When should they seek the attention of a vascular surgeon? Dr. Robbie.
Thank you, Dr. Rajesh. So, I think I'll just come back to a basic first principle. What is vascular? So, it's something I think which not a lot of people might know. Vascular refers to blood vessels. These blood vessels are the highways of life. They are the ones that carry the blood, the oxygen, the nutrition, the medication that different parts of our body need to survive and maintain themselves. So when you get disease of these blood vessels is when you get problems. Now, what are the kind of diseases you can get? Like Dr. Rajesh mentioned, one of the commonest things is atherosclerosis, which is cholesterol. So cholesterol causes hardening and blockages of blood vessels. So it's like we are in Bangalore. What's Bangalore most famous for? Good weather and bad traffic. So this bad traffic is exactly what you get in the blood vessels of the body. So when you get a traffic jam, the blood does not reach where it should. So the oxygen does not reach, and as a consequence of which you get symptoms. Now, what can these symptoms be? If the traffic jam isn't too bad and if the side roads are working, when you get a blockage, there is reduced blood supply, but enough to manage. But when you start putting more demands on that part of the body, it struggles. So, for instance, if you get a blockage to the blood vessel in the leg, you're all right walking 10 meters, but you try to walk 1 kilometer, you can't because not enough blood is reaching there to do the work. So, that's kind of the earlier stage. Now, if you get a really bad blockage and there's not enough blood getting to the foot or to whatever part of the body is involved, you can actually get death of some of the flesh of that part of the body. So if it happens in the foot, you can get gangrene. You can land up with what we call acute limb ischemia, where people end up losing their limbs. If it happens in a blood vessel in the brain, you get a stroke. This is similar to what happens in the heart. When the blood vessel in the heart gets blocked, you get a heart attack. So when we talk of vascular disease, we talk of reduced blood flow due to blood vessel blockage. Now that is the commonest kind of blood vessel disease that we get. There is the other side of blood vessel disease, which we call aneurysms. So a blood vessel is supposed to be a certain size, might be 1 millimeter, 2 millimeters, 10, 15 millimeters. And it's supposed to maintain that width and size. Sometimes the blood vessel wall, which is the pipe which is carrying the blood, gets weak. And when it gets weak, it balloons out, and that's what we call an aneurysm. And a ballooned out, weak blood vessel, the risk with that is the risk of it bursting. Now you can imagine if the main blood vessel in your body were to burst, it's going to be a life-threatening problem. Albert Einstein passed away with a burst blood vessel. First Prime Minister Jawaharlal Nehru passed away with a burst blood vessel. And these were diseases which were not diagnosed at that time. And aneurysms, unfortunately, are typically asymptomatic. That is, you don't have any pain, any discomfort from them until they have become seriously life-threatening. Fortunately, with so many scans being done, ultrasounds, CT scans, MRIs, the detection of these aneurysms, which are lying hidden inside the body, is much better than before. So, if you were to summarize, if you have problems with difficulty with walking, if you're getting black wounds in your feet which are not healing, if you have a stroke, a mini stroke, or if sometime an aneurysm is detected on a scan for something else, these are things that need evaluation by a vascular surgeon. Treatment can vary from medication, lifestyle changes, which are essential. It may involve a surgical procedure, which can be in the form of two things. It can be either in the form of an angioplasty stenting, which is similar to what you do in the heart, but we do this in other blood vessels in the body, or it can be in the form of open surgery. Which procedure you need, what medication you need, is something which would be decided after your evaluation. Now, over here, I would actually like to bring out one thing, Dr. Rajesh, and perhaps you can clarify on this. Why are vascular surgeons unique when it comes to angioplasty, stenting, open surgery, medical management? What's different about this specialty of ours?
So one of the most important thing is a vascular surgeon is a very important specialty, and now it's a super specialty. What does a vascular surgeon is interesting because he is a gentleman who is trained over the period of time in both the procedures. That is, he can operate and simultaneously he can do an endovascular. That is, you can do an angioplasty, that is a minimally invasive procedure, as well as operate. By this, he is a complete surgeon as an endovascular specialist because if there is by any complication as such, unlike an interventional radiologist or a cardiologist, if there is a complication, he can deal it himself. So I feel that as a vascular surgeon, he'll provide all the tenets of surgery as well as a minimal endovascular enthusiastic so that he treats all the vascular diseases completely.
Thank you, Dr. Rajesh. If I could add one thing to that, like I completely agree with what you say. See, one of the beauties, so when you go to a doctor with a heart problem, if you go to a cardiologist, you will typically be treated, if you need it, with an angioplasty and a stent. And if you go to a heart surgeon, you're more likely to be offered a bypass operation for the heart. I mean, obviously, they will make a judgment as to which is appropriate for you. When it comes to vascular surgeons, we do both the angioplasty, stenting, and the bypass. So for us, we have an understanding of what are the benefits of angioplasty, stenting, what are the side effects, what are the benefits of surgery, what are the complications, what are the limitations. And that allows us to judge both therapies equally and see what is appropriate for the patient. And vascular surgery is actually the only specialty of this kind in India which has this kind of commonality of treatments. Like if you look at some other specialties, you have gastroenterology and gastrosurgery, you have cardiology and cardiac surgery, you have neurology and neurosurgery. While in vascular, there is one specialist who is trained in all aspects of care, which makes us very unique. And I expect that increasingly across the world, this is going to be the pattern for all super specialties in the future. So, Dr. Rajesh, what is it about the training of vascular surgeons that makes them uniquely situated for something of this sort?
So usually what happens is a person who is trained already a surgeon, he'll go to a rigorous training for 3 years. And as of what practice is going on in the country in India is you have cutting edge centers like we are having one of the best centers within the 10 in among the country rated as that. Why it matters in the sense, as I mentioned previously, a vascular surgeon should be trained both in open skills, that is open surgery, as well as endovascular. This is the centers where they train both endovascular as well as the surgery. So here again, there is a misbalance among the vascular surgeons where they can be only doing open skills. So you need both the skills to deal with that, as my colleague was mentioning, so he can treat all the spectrum of the vascular diseases. And number two is this, we have a rigorous program where the surgeon comes and trained for 3 years. Then after 3 years, he's been given a degree in terms of, we call it as the DNB or a MCH degree, where he's trained in both vascular, endovascular, as well as the open skills. So he goes for a rigorous training. And after that, he wants to specialize in particular, like what he's mentioning, like he wants to do an aneurysms and they are doing the only endovascular for a chronic limb-threatening ischemia, that is the diabetic foot or ischemia of the limb. He can specialize more in that. So again, these are all the niche areas. So minimum training goes from 3 years, then he can do what is called as a higher vascular training. So they can go to other centers, train and come back and join us. This is what a vascular surgery training is about, all about that. And there is also fellowships abroad, like in America, England, and Australia. They can, even if want to train much more into the skill of that special areas also, they can go and come back and train all that. So this is all about the vascular training, which I wanted to talk about that.
Yeah, so I think I would also just like to bring to the awareness that vascular surgery has kind of become a very technology dependent field. And there is incredible advances in technology which allows us to do procedures in a very minimally invasive way. So, you know, when I trained in England 20, 25 years ago, a lot of the surgical procedures had to be done by open surgery because that was what was the best way to treat it given the limitations of technology. Today, we have got technology which allows us to suck a clot out of the heart or the lungs. We can clear a blockage in a blood vessel. We can repair a leaking blood vessel which is threatening to life. And you can do all of this through a small injection and a small puncture with the patient being awake. In fact, just last night, a 16-year-old child came in with a life-threatening condition which she would have possibly died from. And we were actually able to fix it by doing this procedure through a small injection in the leg. And she is back to her room now. And, you know, for these technologies to be available and to be accessible and to have the expertise to use them has completely transformed the vascular world in the last few decades. And, it's really important for us as vascular surgeons, like Dr. Rajesh was saying, with training and, to keep up to date with what is available. And being in a center like Narayana, which has got a high volume, which has got every specialty and cross specialty available for support and for cross learning, allows us to do a lot of these things over here. So I would actually like to end here with a word that, we would really want your vascular health to stay healthy. And what can you do for that? A couple of things you can do is exercise, eat healthy, low salt, keep your cholesterol under control. And one of the single most important things that you can do to improve your health is to give up tobacco in all its forms. Tobacco is the biggest poison that exists. And if you want to live a long, healthy life, these simple things should help you to do a lot better. Thank you very much.
Thank you very much.